Hi, welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. And today we're going to be talking about procedures and how hospitals and surgery centers are doing things different and making it safe in our COVID-19 world. As of June the 25th, there are 2.3 million cases of COVID-19 in the United States and 121,000 deaths. And it's also important to know that the numbers are starting to accelerate a little because some restrictions are being released, and that's to be expected. But hello, Dr. Sherman.
Good afternoon, Noah. How are you? Good to be back.
Good. So, you do procedures, don't you?
Yeah, that's a big part of my job. That's what, once our procedure center opened a couple weeks ago, or about a month ago now, that's what enabled me to get my office back on track and open it. So that's a big part of the job and kind of dictates how things go around here.
Yeah. And I would like to start off by talking a little bit about probably the difference between hospitals and surgery centers, because I've never been to a surgery center. Luckily I haven't had to have a surgery, but
Right.
I know that some people have been to surgery centers and hospitals, and it's like, I know they're very different in certain ways. So would you like to enlighten us on that?
Well, a surgery center is what they call an ambulatory surgery center, ASC, meaning the patient walks in to the surgery center, has his or her surgery or
Yeah.
procedure, recovers there, and then goes home directly from there. But it's a legitimate OR, sterile and
Okay.
everything, and they're doing real surgeries there, like an appendectomy, a cholecystectomy, or a gallbladder being taken out, or an OB/GYN, procedure, and something on the ovaries or the uterus. Then they get stitched up, or an ENT procedure like a nose job or a deviated septum, or a lot of pain management. My point is, there's some real surgeries going on, but you don't have to stay overnight in a hospital. So you go home and
Okay.
you recover from home.
From home. Okay. So I can see
The
the
center
risks associated with
closes
that.
for the day. Yeah. And then the surgery center closes, and then it starts up again the next day. A hospital, is a hospital where patients stay overnight, and there's more significant cases. That's not to say those types of cases are not done at a hospital. They can be. In fact, some hospitals have like a surgery center wing to them,
Oh,
where the patients would go home. But the actual hospital would be different, with patients, sicker patients who need to stay in the hospital after surgery, bigger
right.
surgeries that require some, more close follow up, so the doctor can come see him in the hospital every day. And the risks are a little bit greater of infection and some post op things that need to be followed as a inpatient hospital patient.
So it seems to me that the difference between them is really based on like the severity of the surgery and
Right.
the
The type of
recovery from it.
procedure that's being done.
Right.
Yeah.
Because I think you even
Uh,
said that plastic surgeries, those are usually done at surgery centers.
yeah. Plastic
Yeah.
surgery and reconstructive surgeries and breast augmentations, nose jobs, facial facelifts,
Yeah.
breast reductions, outpatient surgery centers, and then patients either go home or go to like an overnight uh, care place.
Okay.
The you're correct. The type of surgery, the simpler surgeries, and the type of surgeries, and we do our colonoscopies at a surgery center, the endoscopies at a surgery center. They do some pain management. All that's
Okay.
very doable at a surgery center. The other thing that would determine if a case is done at a surgery center or not is the type of patient. If the patient
Okay.
is a risky heart patient
Ah,
who's
yeah.
had
Okay.
bypass, or has kidney disease, or has some chronic lung stuff, taking that patient to an outpatient surgery center may not be the best idea, because there could be,
Yeah.
the
If something
potential
goes
risk there.
wrong.
Yeah, so you're not at a hospital now, so you're at a little bit of a disadvantage. So you take that patient for whatever surgery to the hospital. You've got the backdrop of the hospital as a safety net, and that's when a hospital would be the best. So the type of patient and the type of surgery, dictates in terms of the location.
I see, I see. And yeah, the essentially you go to a surgery center if it's, yeah, like you said, it was a risk thing, where at a hospital, if something were to go wrong in the surgery, then you have the hospital right there so that you can be taken care of, and they probably have more resources. And I
Oh
think
yeah,
that's kind of what this goes down to, is distribution of resources and like using them. Because like I said, at a surgery center, you wouldn't want to take up a hospital surgery slot with surgeries that are very, very unlikely going to need it.
exactly. I mean, you both ways. You want to use the resources wisely. Plus, at surgery centers, you do the more stable patients, and 99 point something of the percent of the patients go home that day, do great.
Yeah.
Once in a while, you have the unstable patient. Oh, why did this patient come here? You should have gone to Cedars. You got to call the paramedics. Then they take him to Cedars. You got to write up an incident report. There's a lot of paperwork
Oh,
that goes on with that. So I'm not saying, you that's one reason not to do it. You just got to make the right decision in terms of this patient belongs at the hospital. This is a stable patient. He's a young patient. He belongs at the surgery center. So you make that determination based on the type of surgery and the patient's overall health.
I see. So because hospitals are probably more, I mean, hospitals of course take in everybody. They take in all kinds of patients, not just surgery procedure stuff. So I imagine surgery centers and hospitals are doing things different to prevent COVID-19 transmission.
Well, right. So I can speak for the surgery center in particular. We have the waiting room. Uh, it was a big waiting room that could hold 15, 20 people. Now it's just four patients at a time that are in the corners. Patients transportation can't come up to the waiting room with them, and can't pick them up. It's a one-way thing. The gurneys are going down the hall this way and then going back to
Okay.
recovery through the other hallway that way. There's no crisscrossing paths that there was. They're staggering the start times of the procedures, and allowing an extra 15 minutes for cleanup in between procedures. Whereas before it was just like, let's turn it around and let's keep going. Now there's this extra 15 to 20-minute cleanup time involved.
Okay.
Everybody who comes in is tested for COVID prior to coming in. Of course, they're going to be negative. If they are positive, their procedure does not occur. They have to quarantine and the whole bit.
Uh-huh.
And everybody's wearing the masks and washing their hands and wearing protective gowns. And as I said, the number of patients running through there are fewer than before, and they're all sort of running parallel tracks. They're not crossing over, and there's not a lot of shared airspace.
Okay.
I would imagine the hospital's doing the similar thing, but um, the hospital has separate isolated COVID area,
That's
uh,
right.
the ICU and for non ICU patients alike.
Yeah, and that's really important, being able to separate all the pandemic cases and then just normal cases, because right, the regular illnesses don't stop happening, so
Right.
you still need to pay attention to that.
That's
Like
been a
you're
theme of the program from the start. The
exactly.
chest pains, the abdominal pains, the gallbladders, the appendixes, the congestive heart failures are all still happening. Now, in those chest and those upper respiratory symptom patients, they got to test for COVID as well. But if once they're negative, they're treated like a regular CHF patient and get them better.
Yep. We have a nice question from the chat. When you
Oh,
say a
good.
test is done before, um, are the results of the COVID test received the same day as the surgery?
Excellent question. The testing takes about 48 to 72 hours, and we need the test to be within that 48 to 72, and in some cases, like 84-hour window.
Okay.
So
3 days,
for a
two and a half
procedure
days.
at a surgery center on a Friday, you go get your COVID nasal swab on the prior Monday or Tuesday with the hope to get the result by Thursday night to go ahead on Friday morning's procedure. You follow that?
Yeah.
It has to. It can't be done the same day. The tests aren't that fast. Most tests are 48 hours. In this days of increased ramping up the test, it's getting to be more like 72 hours. They just can't handle the load.
Whoa.
So if you go for a test on Monday, 72 hours later is Thursday. You're negative that Thursday. You're good to go the following Friday. That's the limit of what you can do.
Yeah,
That
that is the
test is
limit.
not good for Monday. You got to retest. It's really that 72 hours. You got to be negative in that 72-hour window. So you can't get a test on June 5th and go for your procedure on June 15th. It's not soon. You got to go for your procedure on June 5th, and no later than June 9th would be your
I
procedure.
see.
You see that 4-day window.
And of course, there's a risk there of someone maybe contracting COVID between the testing and the procedure. So I imagine.
That's exactly right. You're gonna
Yeah,
get you gotta in a perfect world you would tell the patient to sort of quarantine in those 4 days. Um, they may stay home pretty well, but you know, yeah, but you're right. They can be negative because they tested on Monday. In theory, get it on Tuesday or Wednesday, not know it. Negative test for Monday comes back Thursday, and they walk in positive on Friday. We don't know, but we
right.
just got to go with what we got. Do the best we can, and yeah, that's kind of the way there's going to be some risk out there.
Do we happen to know the minimum amount of time it takes for exposure of the virus to being able to transmit it again?
Well, I think there's a 5-day incubation period. So in theory, your exposure and symptoms are at 5 days. We know that there's asymptomatic patients, but I think those asymptomatic patients, on day 1, 2, or 3, can shed the virus uh, pretty strongly. Symptomatic patients shed the virus more so than asymptomatic.
Yeah, because that's
But you
part of the
can be
symptoms.
you can you can start shedding, I guess, within 48 hours of exposure. So, and you very well could be asymptomatic in that range. That's why this is a tricky virus. We just don't know who's got it and how contagious they are, and we just got to be prepared.
Right. And kind of going off of that, California has broken a couple records of its own in COVID cases daily. And that's kind of worrisome. That's very worrisome because we were just doing okay with the virus, but now that
Right.
we're releasing restrictions, it looks like there could be another spike in cases like there was
Yeah, I
a
don't know
couple
where
months
these
ago.
spikes are coming from. It's got to be the public settings, the
Yeah,
restaurants and things like that. As we spoke about last week, the number of people in contact, the time you're exposed, and the proximity, all of those in that list we went over. I mean,
exactly.
I think there's the people are going out and sitting in public places for hours at a time, and that's the positive cases right there. If you sit home, wash your hands, wear a mask, or you go to work and go right home after that, or if you go for a walk and avoid people, and you're probably not going to get it. You go to restaurants, bars, crowded places, even if it's outside, and sit there for an hour at a time, yeah, you may get
Yeah,
something.
yeah. And it's very important because like especially since the cases are increasing right now. Those are only the cases that were measured increasing.
Yeah,
You have to always remember that there's going to be more cases out there of COVID-19 than we know, just because there's always going to be people out there who aren't tested and who do have it.
right.
And because it takes time for tests to come back anyway. So as
Yeah,
we
yeah.
see cases increase, we have to be even more vigilant about avoiding the spread of the virus. And
Right.
that's just a reminder for everybody out there.
Yeah, I mean the
Take it seriously now.
yeah, because you're even asymptomatic patients are getting tested, and some of them are being positive. So there's a good chunk, and I think this is a double-edged sword. There's a good chunk of folks who are asymptomatic and have the virus. It's not a great thing because they're asymptomatic and could be spreading it, but
Right.
they have it and they're feeling fine. So I mean, how
Mm-hmm.
bad is this virus if you have it and you feel great,
Yeah,
right?
that's a little bit of a
Uh, so I'm not saying go out and spread it, but if you have it and feel fine, I mean, that's not the worst thing in the world. It's better than having it and being in the ICU.
right. It's better for the person, of course. Like you need to still
Right?
wear a
It's just
mask.
tough to know how. It's tough to the transmission, which is a public health problem. That's where it gets dicey.
Exactly. And of course, what's tricky about this virus is that I was confused about this many months ago when I was first hearing about asymptomatic people. At first, I was confused because I thought that the virus had to be coughed or sneezed in order to be transmitted. So I kept thinking to myself, asymptomatic, shouldn't that not be a problem? Well, it turns out this virus can actually transmit without coughing. You just have to basically just be talking,
Yeah.
and the water coming out of your mouth could have virus particles
Right.
on the droplets, and
Yeah.
that's how it transmits. And that's why you need to wear a mask. And I noticed that some people like to take down their mask when they're speaking, but that's actually exactly the opposite what you want to do. If anything, if you want to take a break from the mask, you should pull down the mask when you're not talking,
Right.
when you're not doing anything with your mouth, and then put it
Right.
up when you are talking.
And ideally, you would not take a break from the mask at all.
Right.
I'm sitting here in my office with nobody around, so I'm not wearing a mask. But the second I leave the room, or the second somebody comes in to do a little filing, I have my mask ready to go, and it just goes
Mm-hmm.
right up.
Same with me. There's
Real
nobody
quick.
here.
And you're right. People are walking around, with the mask, kind of doing this sort of thing. But that doesn't help you. You need
No, it
to
doesn't.
get it all above. But you should wear it. Yeah. If you want to take a break from the mask, normal breathing is the time to do it. But
Mm-hmm.
ideally, you shouldn't take a break because even normal breathing, it's going out there.
Exactly. Especially if you're breathing through your mouth. I would imagine breathing through your nose is significantly less
A little
on
less,
the
it goes directly
transmission.
down. There's
Yeah,
less
that too.
air. Yeah, the mouth is the big one.
Right. And another thing too is I forgot, but that's okay because I know remember face shields, remember those things?
Yeah.
Uh those things are some people have said that they're as good as masks, but yeah, look at that face shield. See that looks like a really good one. There are some face shields that are more flimsy.
Yeah.
But that looks like something durable.
This is
So
good. It'll wrap around your whole head. I'm not going to put it on right now, but it wraps around your entire head,
look around.
and it circulate and it will protect from the side too here. And droplets aren't going to kind of do a left turn, right turn. It'll protect your eyes, nose, and mouth in one. And wearing a mask on even under it's even better. And that's when you're in places where secretions are flying, an ER, an ICU.
Exactly, they're flying.
Out. Those big crowds that are screaming things. Droplets are flying. This face shields would come in handy, so that's a good thing to wear in those high risk zones.
Right. And let's see. So I do have an example of a face mask here, although it's significantly less high quality. I'm not even sure if it's designed for it, but it is.
Yeah, that's pretty good.
It's something.
That's a pretty good one.
It's
attached to that hat.
Yeah, it's attached to a hat. That's how it works.
Yeah.
It's pretty big. It's not firm, but I don't know actually how much that matters.
Well, it wraps around the side of the head, the face pretty well, so that's going to, have a good protective effect. The problem with face shields, it's masks are tough, but face shields are even more so. I mean, you can get pretty stuffy back there after a while.
Mm-hmm.
So you can't really wear that for too long a time. You got to pick and choose your spots before having to breathe better. Just like the N95 masks, you can't keep those on for 8 to 12 hours at a time. You got to just take a break.
yeah, it's gonna make your face really sweaty.
Yeah,
And I imagine I imagine the mask itself would start to deteriorate if exposed to certain things for too long.
yeah, yeah. You would ideally like a new fresh mask every day. There was a shortage for a while, but I think it's okay. And that's the thing. The hospital, if you're a the hospital has a lot of those sick patients potentially. So as we were talking about surgery centers before, if you're an able-bodied, relatively healthy patient, you would want to go to that surgery center for your procedure and not expose yourself to some of those sicker patients in the hospital that all
Exactly.
these face shields are required for.
Right, yeah, that's a good point because surgery centers are usually, I mean, yeah, sometimes hospitals have their own surgery centers, but usually surgery centers are not exactly right next to a hospital. They're just somewhere
Right,
else. So that means there's also just going to be less people there because it's only surgery center stuff. It's not going to be people going in because they're sick with COVID-19 or with anything else.
right.
So if you think that maybe not so much if you know that you are healthy bodied and the doctors also approve of you going to a surgery center, I'd imagine that you should go to a surgery center for a
Yeah.
procedure.
and and
Exactly.
and, and it's cheaper too. I mean, the surgery,
Yes.
and this isn't a economics program, but the surgery center is going to charge the insurance company much less than a hospital would. So the patient's out of
That's a nice
pocket is going to be better too. Um, you know, in network things may vary, but my point is, if you compare apples to apples, the same insurance, if a hospital's in network, or and the surgery center's in network, the surgery center is going to leave the patient with less out of pocket money.
exactly. And one thing that I just kind of thought about here is that if you have obviously there's more than one surgery center per hospital. The surgery centers are all over the place. I don't actually know the numbers, but I'm I think there are more surgery centers than hospitals, right?
Yeah,
No,
I
there's
mean
not.
Beverly Hills here's got 8, 9, 50, 12 surgery centers within a 2 mile radius. I mean, they're all over the place. It depends on the community, but Beverly
Yeah, it
Hills
probably
got
depends heavily. So I would
West
imagine that
LA
people
over
should
by
search.
UCLA's got a few. Santa Monica's got a bunch. Yeah, they're everywhere.
So if there's a lot of basically the more surgery centers there are, that means there's less people going to the main hospital, which means that in a way it's kind of like controlling the crowd of people going to the hospital and it's spreading them out further, which means less contact for less transmission.
Right.
And
Yeah, I mean, that's for the hospital too. And if you remember in the beginning, the um, the governor or whoever they said no outpatient procedures, whether at a surgery center or at a hospital, and that's a way to cut down on the transmission right away. So you got to be careful when you're restarting to minimize that risk. I talked about how to do it at the surgery center. They probably the same way at the hospital's wing of the surgery center or their outpatient part. But hospital, it's a big moneymaker. So the hospital is going to start up
that's true.
again, and surgery center is going to start up again because patients need the procedures. Number one, and most importantly, of course, but number two, that's a big moneymaker for the hospital,
Right.
for a hospital. So they'll need the business. So after a while, it's
Yeah.
time to get back to work with the right precautions in place, of course.
Right. And one thing that I think might be very interesting is that if and one slash if, because we don't quite know, if we have COVID-19 under control and if we have a vaccine that works and everybody and it clears off, it becomes not a threat anymore. I
Yeah.
wonder if we're going to be able to look back on this period, and actually look at the data for people getting infections of other diseases and seeing how much those decrease. Because I imagine because of all this quarantining that there's going to be people not getting sick as often from
Yeah,
normal things.
absolutely. I mean, just from my own experience, I mean, no, I mean, I'm good for a couple colds a year, but this time without human contact, no cold, no cough, no anything, COVID or not. So yeah,
Yeah.
all the other illnesses are going down
And I
because
think,
of the quarantine. Now that's not a realistic way to live life, so it's going to
right, because look at the cost.
emerge a little bit down the road. And my goal is to get the COVID data to where the flu data is, which means you know the same incidence rate, the same death rate, the same type of thing. Because if there was therapeutics out there and a vaccine, then we can definitely loosen up without having to fear a lot. And if it gets to where the
Hmm.
flu is, well, we deal with the flu with its
Yeah,
statistics right now by going out and about, so we can deal with COVID the same if it's the identical or nearly the identical
exactly.
outcome.
In the
But
future,
yeah,
they
all
might
the other
even,
other viruses are still out there. You got to keep that in mind.
right. And in the future, they might even merge the COVID-19 vaccine if it's going to be a yearly thing with the flu
Yeah,
vaccine.
right,
Who knows?
right. And there's a couple of vaccines in the pipeline that hopefully by the end of the year will be promising and be available for mass distribution.
Yes. We have a good, maybe final question from the chat. If someone tests positive for COVID, how long should they wait before they have a medical procedure? I guess they would have to. You go on.
The usual protocol is you test positive, you quarantine for 14 days and just sit there for 14 days. That's your first 14 days. Then, uh, if you're afebrile, if you've quarantined for 14 days and you're afebrile, you haven't run a fever for
Okay.
72 hours, then you get a test. And if you're negative there, you wait an additional 48 hours and you get a second test. And if both those tests are negative, then
Oh.
you're good to go be released back into society and get your procedure.
Okay. They're checking for relapse with that extra 48-hour difference. It looks like we run into this problem again, where later on the connection
Checking
starts
to see
buffering.
if the antibodies for the virus.
Yeah. Um.
Yeah, I lost.
Oh, okay. Looks like we lost each other actually at the same time. Which is
Yeah,
fine.
they're checking to make sure you overcame the first virus. Relapse is down the road. How
Okay.
long? I'm not exactly sure, but that initial infection, 14 days and 72 hours afebrile, two negatives at least 48 hours apart after those two criteria are met.
Okay. All right.
So it's a little bit of an ordeal, but and hopefully you don't feel too lousy during the time.
I think that's a great place to start wrapping up our show today. So hospitals and surgery centers, basically, if you need to do a procedure, it's based on risk because a hospital, of course, is going to have all the resources you need if something goes wrong, but a surgery center is going to be cheaper and going to have less contact with COVID-19 just because there's less people there. So those risks should be gauged by
Right.
you and your doctor to know whether you are someone at risk and you should go to a hospital to be safe. And of course, you have to remember that because cases are increasing in California right now, you have to be even more vigilant and you have to wear a mask even when you're speaking because speaking does transmit the virus. You should not pull down your mask when you're talking. If anything, if you really, really need a break, you should pull down your mask when you're not talking, nothing, just breathing through your nose. And, just wash
Right.
your hands when you're doing things so that you're not potentially transmitting anything.
Keep those hands off.
Exactly. So thank you for
Exactly.
being here, Dr. Sherman. It's always a pleasure. Nice to have you on the show. And if you would like to see,
Yep. Thanks for having me back.
yeah, if you have any questions, you can email me at myworldsciencetv@gmail.com. And if you want to schedule a procedure for Sherman, you can go to towergastro@gmail.com, I believe. Yes, should be it. Right. All right.
Yep. That's the number.
So every
Thank you.
Thursday at 3 p.m. So see you next week for our next